today in Newcastle, because that is what they need to keep their workers safe and provide protection to all of us.
Yeah.
It's an important point, Mr. Deputy Speaker. And when the country first discovered Omicron, of course, the tests that were in stock at the time weren't designed for another huge wave. But the testing, the people that run testing at UKHSA, they responded very quickly by ordering almost any lateral flow test that meet our standards that they could find. And as I said earlier in my statement, in December, we had 300 million as opposed to, I think, around 100 million that was originally planned. And in January, there will be 4 times the pre-planned amount. In answer to her specific question, for people, whether it's for a workplace or for visiting a care home or whatever it is, they will be able to get access to the lateral flow tests now that millions more have arrived in the country. They've been distributed, and they can get them online or they can get them through pharmacies.
Peter Barron.
Thank you very much, Deputy Speaker, and I'm very grateful for the excellent Minister coming to the dispatch box yet again to update the House, and particularly to make an announcement first in the House rather than to the media. I wonder whether the Secretary of State would agree with Lord Frost, who said, "I'd like to see the government ruling out lockdowns for the future, repealing the legislation, ending them now. We can't afford it, and it doesn't work. Stop doing COVID theatre, vaccine passports, masks, stuff that doesn't work."
Mr. Deputy Speaker, I have huge respect for Lord Frost and also for my honourable friend. And I think for what my honourable friend has just shared with us, these are very important points. No one wants to see this country go back into anything that resembles a lockdown. As my friend would have, my honourable friend would have heard earlier, that yes, we've had some restrictions, of course, put in place, the so-called Plan B over the last few weeks. But I hope he would agree with me that even when we reflect on those restrictions and compare them to other countries in Europe, large or small, we are the freest country in Europe. And the reason for that is because of the pharmaceutical defences that I talked about earlier, the most boosted large country in Europe, the most antivirals per head, the most tested, and that is what we should be focusing on for the future as we learn to live with COVID.
Dean Diana Johnson.
Mr. Deputy Speaker, I just want to press the Secretary of State on the morale of our NHS and social care workforce. Between March 2020 and May 2021, he will know that 1,561 NHS and social care staff died from COVID whilst working on the front line. And it's part of the reason why I'm campaigning for an NHS and social care covenant, just as we have for the armed forces and the police. But what does the Secretary of State have to say to those key workers who saw colleagues die while the Prime Minister was at the law-breaking works party on May the 20th?
I mean, the honourable lady is absolutely right to raise the importance of morale in the NHS, and I know, like me and every member of this House, she will know full well the huge debt this country owes to everyone that's worked in the NHS and the care sector, especially over the last 2 years. And she's talked about campaigning for a NHS covenant. I'm not sure how much longer she needs to campaign, because I've already announced that we're going to have one. I'll be happy to work with her about how we could do that, but she can desist on her campaign and put her efforts into working with me to actually help introduce one. She will know that as Home Secretary, I decided that the police should also have a covenant, and so it is right that we do recognise the NHS in this way too. As for the point she made about the Prime Minister, I'll refer to the answer I gave a moment ago.
Alicia Cairns.
Mr Deputy Speaker, as my right honourable friend knows, despite my enormous respect for him, I did vote against the introduction of COVID passports before Christmas. I maintain my view that they are not effective. So will he please commit to dropping domestic certification at the earliest possible opportunity? And will he also today, from the dispatch box, make clear to NHS trusts up or down this country that he will not stand for the pandemic of arbitrary discrimination we are seeing against pregnant women and their partners and parents who want to be with their children on paediatric wards but are being stopped by NHS trusts in an illogical and unscientific manner from being with them to look after them and advocate for them?
I mean, first of all, Mr Deputy Speaker, I agree with my honourable friend absolutely on what she has said about pregnant women and with every word that she has just said, and that is a message that has been reinforced at every NHS trust, and I thank her for how she has campaigned on this issue and brought it to light, because it is making a difference. On the issue that she also raised around the domestic certification, I have to say I do share my honourable friend's instinctive discomfort. So I want to assure her, I will assure her, the House, that as far as I'm concerned, that we won't be keeping domestic certification in place for a moment longer than absolutely necessary.
Vera Hophouse.
Thank you, Mr. Deputy Speaker. And may I, from the Liberal Democrat benches, also pay tribute to the services of Professor Sir Jonathan Van Tam. Mr. Deputy Speaker, the government is still ignoring people who are clinically extremely vulnerable, and their concerns and the lack of guidance and support. I have raised this with the Secretary of State before Christmas, and I still have many of my Bath constituents writing in about this. 2/3 of housebound people have not received the booster. So what is the government doing to make sure that the vaccines are accessible to everybody, including the housebound?
Mr. Deputy Speaker, of course, the Honourable Lady, when she talks about making sure everyone gets access to the booster, the people at the top of the list should be those that are clinically extremely vulnerable, as long as the vaccine is something that can work for them. And that is why during the month of December, especially when we have accelerated the booster programme, working with GPs mainly, but also others, that those that are housebound or in care homes have been a priority, and we have seen the booster rate rise substantially. And also, can I point her to what I said in my statement earlier about the 1.3 million clinically extremely vulnerable that we have also contacted, the NHS has contacted directly to make sure that they have access to the new antivirals that we have procured, which I'm sure that is something that she would welcome.
Marco Longhi.
Thank you, Mr. Speaker. Can I thank the Secretary of State for the statement he's brought forward with such positive news that will bring confidence to individuals and businesses as they want to go back and return to a more normal life as we learn to live with COVID. My constituency of Dudley North actually has many, perhaps a higher proportion of small self-employed businesses, and they were absolutely terrified in the run-up to Christmas that we were looking at lockdowns and severe restrictions. So can I thank him and the Prime Minister for the balanced and proportionate approach that the government has taken in looking at how we move forward and steps that it took during the Christmas period. And can I seek assurances that this will continue to be the way?
Can I first thank my honourable friend for his comments and support of the changes that I have announced today. And he's right to point to a key difference in our approach during this Omicron wave compared to any other country in Europe, I think any other large country. It is not by accident that we have been the most open, the most freest in Europe. It is by design. It is because we have rightly focused on the booster programme, with 79% of eligible adults boosted, the most boosted country in Europe. We have more antivirals per head than any other country in Europe. We are testing more than any other country in Europe. It is these pharmaceutical defences that will allow us to live with COVID, to keep businesses open, to protect the life chances of our young people, and to keep our country open and free, just the way he wants to see.
Jim Daddy.
Deputy Speaker, I'm sure the Secretary of State will want to join me in paying tribute to the staff at Cardiff and Vale Health Board for their work on the booster programme. And you'll know today that the statistics show that, in fact, Wales is joint first in Europe, actually ahead of the UK average on delivery of boosters, and that can only be a good thing for our population. But will he say a little bit about what the JCVI is discussing and what his views are on further boosters, indeed for people who are older and more vulnerable, the immunosuppressed, the use of polyvalent vaccines going forward? Because obviously as we open up further, there are people who are going to be deeply worried about that, particularly with waning boosters. So will you say a little bit about the plans for further jabs for those most vulnerable?
Yeah, well, first, Mr Deputy Speaker, I would join him in commending Wales in their rollout of their booster programme. And in fact, throughout the UK, in Scotland and Northern Ireland, in every part of the UK, we've seen a very good positive approach, protecting more and more people. In terms of the JCVI, I will point the honourable gentleman to two more recent announcements that he may or may not already be aware of. There was one just before, I believe, the Christmas break, where the JCVI recommended to the government that at-risk 5 to 11-year-olds are offered the paediatric vaccine, and we have accepted that. I have accepted that, and that will start this month, and I believe that will start across the UK, so including Wales. And the second recommendation we received very recently, I think it was just at the end of last week, was that after carefully looking at the very latest evidence, some of the evidence I referenced earlier from UK HSA when I made my statement, the JCVI decided that we should not offer a fourth dose to over 85s or others at risk at this point, because they were comfortable that the protection that is provided, and when they looked at waning, was still incredibly strong for older people.
Metcalfe.
Thank you, Mr Deputy Speaker. Can I add to the chorus of approval for the decision to reduce self-isolation to 5 days? But can my right honourable friend ensure that the NHS COVID-19 app and the government website is updated as soon as possible to avoid confusion which seemed to exist around this reduction to 7-day isolation, to ensure that people fully understand their obligations and when their isolation starts and when it can finish?
Yeah, Mr Deputy Speaker, first can I thank my honourable friend for his support, and also I will make sure that the website is updated in the way that he says as soon as possible.
Holly Lynch.
Thank you very much, Mr Deputy Speaker. Recent data suggested that just 4% of teachers said that they had readings on classroom carbon dioxide monitors which are above the safe threshold set by the Department for Education. He will be aware that ventilation is becoming a massive challenge in schools, and in primary schools in particular. So can I ask the Health Secretary, what conversations is he having with his colleagues at the DFE to make sure that children can be in classrooms, can continue to learn, but do so safely as possible, protecting them and the wider community?
It's an important issue raised by the Honourable Lady, to make sure that we're doing all we can as a government to work with schools to protect school children so they can stay in school. No one wants to see what's happened before with the lockdowns and children not being able to attend school in the usual way. That's why I hope that she would have welcomed the recent announcement by my honourable friend, the Education Secretary, on a huge new investment in ventilation. And I know that my right honourable friend, the Education Secretary, is taking this issue incredibly seriously, working with schools up and down the country and seeing what more can be done.
Steve Baker.
Thank you, Mr Deputy Speaker. Implicit in my right honourable friend's statement was the concept that we'll all be held back by the decisions of the unvaccinated. If I may say so, he used some quite heavy language to bring pressure to bear on the unvaccinated, talking about standing on people's shoulders and so on. Yeah. Can I just say to him that wouldn't it be better, rather than creating what does seem to me to be the conditions for coercion and division, it might be better to say to the unvaccinated, you've made your choice to take a greater risk, and we are not going to be held back as a society by your choices. You will have to bear the consequences. Wouldn't that be a more consistent and humane way to deal with them and to deal with us all without creating division?
Well, I mean, first of all, actually, can I also take this opportunity to thank my honourable friend for the scrutiny he provides as well. And as always, he makes important points that are worth discussing. And on this particular point, he's right about the language that I used earlier, because it is factually correct. The reason why this country is as free as it is now is because of the decision that 9 out of 10 people have made to get vaccinated. Those people who made a decision when they could have been vaccinated because they're not medically exempt, for example, but they could have, they've chosen not to do that. And that has consequences. It doesn't just have consequences for them, it has consequences for all of us. My honourable friend might be interested to know that when I visited a hospital last week, King's College Hospital in London, that I was told by the consultant in charge when I went to the ICU ward that was looking after COVID patients, I was told that they estimate that 70% of those in the ICU ward were unvaccinated. 70% were unvaccinated. If those people had got vaccinated, they not only would have been safer, but it would have meant that that space in hospitals could have been used for others. And if that is not just in ICU wards, if you look at the 17,000 COVID-positive patients in our hospitals, this is something that could have been prevented had those that were unvaccinated or decided not to take their booster shot had actually bothered to do so. So yes, getting vaccinated, it needs to be a positive choice. We need to encourage people, and with the exception of the health and social care high-risk settings, it should not be done by compulsion. I don't believe in that. I don't think it will work. I think it's unethical to do so. But the people who have chosen not to get vaccinated should understand the consequences of their decision for the rest of society.
Clive Efford.
Thank you, Mr Deputy Speaker. Following on from that, and paying tribute to all NHS and care staff, we're 17 days away from the first deadline when NHS and care staff will need to get their first vaccine if they're to be vaccinated by the deadline of the 1st of April. What we didn't hear in the Secretary of State's statement is anything about a long-term strategy for staffing in our NHS to deal with the current vacancies and unfortunately those that will come about as a result of the 1st of April deadline. So where is the long-term plan that managers in the NHS are crying out for, and where are we going to get qualified staff from in the future?
Well, I hope the honourable gentleman heard some of the comments I made earlier about the importance of making sure patients are as safe as possible in health and care settings, and I hope that he agrees with that and therefore understands the new vaccination rules, that he's referred to the importance of those rules. But he is right to ask about the planning that is necessary to cope with those changes, and I can reassure him that since that decision was made, in fact even before Parliament had voted in anticipation of such a decision being made by Parliament, the NHS had started planning for this. They are working with each and every trust, but the most effort that they are putting in, I think rightly, is to convince those, I think 6% of people in NHS trusts that have those so far not had a first dose of the COVID-19 vaccine, to convince them in a positive way to make that positive choice with all the information that they need about the vaccines being safe and effective, offering them meetings with clinicians, including one-on-one meetings, and I hope the honourable gentleman supports that kind of approach.
Thank you, Mr Deputy Speaker. I very much welcome the reduction in self-isolation times to 5 days. That will be appreciated by the hospitality industry, particularly in Bournemouth. Mr Deputy Speaker, I'm proud to say that I'm a vaccinator in Bournemouth, and tomorrow will be doing my duty along with thousands of others across the country. It is a critical job and a rewarding one if we are to tackle COVID-19. He'll be aware from his visits that the atmospheres in these temporary hubs is extremely professional, but it can also be quite quiet and sombre. Could I ask the Secretary of State whether he could look at seeing if the licensing conditions for radio could be lifted? Maybe he could speak to the BBC, Classic FM, Virgin Radio. Chris Evans might even be listening to our debates here even today. I hope that he would agree that it would help lift spirits as we go about this important national effort.
Well, first of all, can I thank my honourable friend for his support for today's measures, but can I also thank him for being a volunteer vaccinator. It is people like him up and down the country, but especially in the last few weeks as we made the call for the booster programme that have come forward in their thousands, and they are the people, these volunteers working alongside the NHS, also, may I add, alongside the soldiers and the military that have helped, which is something else I know that my honourable friend has experience of, a direct experience of as well. I've listened carefully to his suggestion, and I think that's a very good suggestion. It's not something I had given thought to before, but I think it is absolutely right that we contact these organisations and see if they would like to be helpful in helping our army of vaccinators across the country. So it's a very good suggestion. I thank him for it, and we shall try our best to act on it.
The incredibly patient Matt Weston.
Thank you, Mr Deputy Speaker. I just want to add my voice to the congratulations to Jonathan Van Tam, but also to all those across our universities and science sectors who contributed so much at this time. And I hope others will get rewarded similarly. Secretary of State's aware, of course, of the shortage of testing kits. He mentioned it in his statement. 120 million now increased to 300 million. On these benches, my right honourable friend was saying, we're desperately keen that business should stay open and that young people should remain in education. Now, I'm aware, of course, that there are separate supply lines for testing to universities, but there is concern, actually, about future weeks' supply. Can the Secretary of State confirm, guarantee, perhaps, that there will be no issue in the coming weeks about the supply of testing kits to our sector, our higher education sector?
Well, first of all, Mr. Deputy Speaker, I think the Honourable Gentleman is absolutely right in the way that he has thanked not just JVT for his service, but also those across our academic sector that have supported the government, supported people, supported the NHS throughout this pandemic. I'm privileged to work with so many of them, not just with JVT, but I can see every day the value they add and how they are helping us all to get through this pandemic. He's right to raise the issue of testing. It's not to 300 million. 300 million in terms of lateral flow tests was December. For the month of January, we have planned at least 400 million. That's 4 times the original pre-Omicron plan. That makes us confident that we have the lateral flow tests that we need. But in terms of, to be more specific, in terms of the university sector and more broadly the education sector, including schools and colleges, they rightly have a separate supply line that is still run through my department, but we work very closely with the Department for Education to make sure that that sector has the supply that it needs.
I'd like to thank the Secretary of State for his statement and responding to questions for an hour. Point of order, Sir Ian Duncan-Smith.
Mr. Deputy Speaker, I rise on a point of order literally as an email from the Speaker has arrived in our offices. The key issue here is that I understand that Mr. Speaker has been contacted by MI5 and is now warning members of Parliament that there has been an agent of the Chinese government active here in Parliament working with a member of Parliament, obviously to subvert the processes here. I say, as a member of Parliament who is sanctioned by the Chinese government, as others, that this is a matter of grave concern. And I therefore rise on 3 points which are really important. Number one, will this now lead to a serious overhaul of the accreditation procedures here in the House of Commons? Because it's clearly too slack that these people get in, either in APPGs or with individuals. Is it possible that we will have a statement from the Speaker, from the Chair, about the risks? I am one of those who has done a lot to try and help fleeing Hong Kong Chinese, fleeing the communist regime here in the UK. We have names and numbers of people, and that leaves me worrying that some of these have been accessed by such an individual. These would be their lives and their families at risk, and I am deeply concerned about this because my activities therefore may well have been traced as those as well from my colleagues and friends. And I understand that the latest news that I hear is that this individual is not to be deported and no further action to be taken. How can it be, Mr. Deputy Speaker, that an agent of a foreign despotic and despicable power that is hell-bent on reducing many of those people into penury, it seems, how can they put somebody into Parliament, this mother of parliaments, and then that individual have nothing done to them other than they're not allowed in Parliament? This is surely not good enough. And could there be a statement from the government as to what they plan to do, and possibly, with respect, of course, from the Chair and Mr. Speaker?
I'd like to thank the Right Honourable Member for his point of order and giving me forward notice of it. As you know, it's not the policy of the Chair to comment in detail on any security matters, and I will certainly not be doing so today. As far as any statement either from the Chair or indeed from a government minister, I've been given no notification whatsoever that that is happening, but should that change, then I'm certain that members will be notified in the usual way. And as far as the third point, as I said, we don't discuss the detail of security issues on the floor. However, I can assure the Right Honourable Member that the House authorities are in regular contact with the appropriate government agencies on this matter, and we will update our advice and activities as necessary. Jim Shannon, further to that point of order.
Further to that point of order, first of all, thank the Honourable Gentleman for bringing it forward. It is such danger and concern for us in this House. I'm just wondering, Mr Deputy Speaker, whether you've had the opportunity to find out if this knowledge of the integration of a Chinese spy in this House has been conveyed to other administrations in the United Kingdom and in actual fact to the Northern Ireland Assembly, because when it comes to accepting those from Hong Kong that the Honourable Gentleman referred to, Northern Ireland will be one of those as well. So we want to make sure that the people are safe, and with that in mind, has yourself, Mr Deputy Speaker, or the House been made aware that the Northern Ireland Assembly, for instance, has been made aware of this? Thank you.
I'd like to thank the honourable member for his point of order. Devolved administrations and the government. Further to the point of order, Tobias Elwood.
Thank you, Mr Deputy Speaker. This is the sort of grey zone interference we now anticipate and expect from China. But the fact that it's happened to this Parliament, there must be a sense of urgency from this government. I'm grateful that you yourself in your comments here today have taken this very, very seriously indeed. But could I encourage and endorse the request for a statement on this before end of play today, so we can understand the ramifications, the impact of this, and what the government and indeed Parliament intends to do about it?
I'd like to thank the right honourable member for his point of order. There again, the Treasury bench will have heard what he has had to say, and as I said earlier on, should a statement be made, then the House will be informed in the usual manner. I know that all right honourable and honourable members will be very concerned by the contents of the email, and as I say, the Treasury bench I'm sure will pass on the comments that she has heard today to the relevant ministers. I'm now going to hand over to Dame Eleanor Lang, who will now proceed to take the next business.